So let's talk about how hair transplants work. Hair loss is a common problem faced by both men and women as they age. Male pattern hair loss, in particular, is a condition that affects almost 50% of men by age 50, even me. While there is no cure for hair loss, hair transplantation has evolved significantly over the years, offering new and improved techniques for restoring hair. In this YouTube video, we will explore the evolution of hair transplant techniques, from traditional to modern methods, and how to choose the best procedure for your needs. For many men, hair loss can be a frustrating and discouraging experience. Male pattern hair loss, which affects up to 70% of men at some point in their lives, is caused by a hormone called dihydrotestosterone, or DHT. This hormone has the unfortunate ability to switch off hair growth in the follicles around the hairline to the crown. As a result, hair in these areas becomes thinner and eventually falls out altogether. While this process can be distressing, there are treatments available that can slow or even reverse the effects of dihydrotestosterone, helping men to regain their confidence and their hair. Hair transplantation procedures have come a long way since the first hair transplant was performed in the late 1950s. Back then, it involved the use of multiple follicle plugs, which led to an unnatural doll's hair appearance. However, research and innovation in hair restoration technology have led to more natural-looking results. And why is that important? Well, the primary goal of hair transplantation is to achieve natural-looking results, which can only be accomplished through the use of modern techniques. Patients not only want to restore their hairline, but also want to maintain the confidence of having a full head of hair. Natural-looking results have essential psychological benefits, improving self-esteem and enhancing overall quality of life. That's why we only do it via FUE, which is follicle unit extraction. This is done by hand, taking grafts from the backside of the head and putting them in the areas that they need to go. The multiple follicle plugging technique, also known as the punch graft technique, was the first hair transplantation method used in the past. This plug method involves removing a large group of hair follicles from the scalp and transplanting them into thinning areas. The problem is the results were super patchy, and you look like a doll with a low survival rate of the transplanted hair. Now, these traditional techniques, like the plug technique, are no longer used today, but they definitely paved the way for the modern hair transplant that is more refined today. So in the modern world, hair transplantation comprises of two main techniques: follicular unit transplantation and follicular unit extraction, which we do at Genesis. FUT involves removing a strip of skin from the donor area and dissecting it into individual hair follicles for transplantation to the recipient site. Follicular unit extraction, or FUE, involves extracting individual follicular units directly from the donor area without the need for a strip of skin removal. Both FUT and FUE offer significant benefits, including natural-looking results, minimal scarring, and faster recovery time. However, FUE is significantly better than FUT, however, because FUT will cause scarring of the back of the head, much like Elon Musk and LeBron James. In some cases, patients do not have enough hair follicles on their scalp to really complete a good hair transplant. In such cases, a surgeon may suggest body hair transplantation, where hair follicles from different areas of the body, such as the chest, the legs, or the beard, are transplanted to the scalp. While this method is less common, it has been proven to be a viable alternative for patients who require additional follicles. However, at Genesis Lifestyle Medicine, we don't do this because it will result in unnatural looking and suboptimal results. Now, for you, if you want to choose the right hair transplantation procedure, it's really crucial to make sure that you're going to achieve natural looking results. Factors to consider include hair quality, quantity, color, area, the extent of hair loss, and during your consultation with a hair transplant doctor, he or she is going to need to evaluate your hair loss condition and recommend the best technique suited to your needs. So it's essential to ask questions during the consultation to gain a better understanding of the procedure, including the risks, the benefits, and the potential side effects. Make sure you're also reviewing all of their before and afters and seeing what you need to do to take care of your hair after the transplant. In conclusion, hair transplant techniques have undergone significant advancements over the years, offering more natural-looking results to patients. It is important to choose an experienced clinic and consider the extent of hair loss, donor area, and recommended technique before undergoing any hair transplantation. Keeping up with the latest advancements in hair restoration techniques and discussing your goals with a highly skilled provider will help you achieve a fuller head of hair and improved quality of life. For more information about hair transplants, go to genesislifestylemedicine.com/hair transplantation. Also, check out the link in the description for more information and a link to my other YouTube video about how I got my hair transplantation done at my own clinic.